is NBC Connecticut.
Governor Malloy has been a blood donor since 1974, and he wants you to be one, too. The governor gave blood at the Yukon Law School this afternoon. Because of the recent winter storms, the American Red Cross is in need of donors.
This is a great way to give back to society and to your fellow human being. There's many different uses of the blood that you'll donate. You're really potentially helping 3 different sets of individuals with your donation, and so it's really important work.
And as the governor said just a moment ago, you get cookies and Dunkin' Donuts coffee, too. The Red Cross kicked off a statewide blood drive today. Joining us to talk more about it, Paul Sullivan, CEO of the American Red Cross, and Dr. Lenworth Jacobs, the Chief of Trauma at Hartford Hospital. Paul, why don't we start with you? What effect has this awful weather had on blood donations?
Right. Well, we're struggling, to be very honest with you. We've been trying to get the word out for the last few weeks. We've been thwarted by the storms. We're about 1,800 units behind where we need to be to make sure that we can adequately supply Connecticut hospitals. And so we are once again, trying to get the word out to donors to tell them how important it is that they respond and come out and donate during this urgent appeal for blood.
Dr. Jacobs, what effect does it have on your daily operations when there's a shortage of blood?
Well, it's very important because people get injured no matter what, and people need heart surgery no matter what. So we have the need on an ongoing basis, and blood is really critical for us.
Do you have to prioritize?
Well, we're fortunate in that we're a big hospital, and we have 150 or so units of blood, and we use about 100 or a little bit more a day. So that we're fortunate to have that, and we have not had to in any way prioritize or restrict anything, but we're very concerned.
What's your goal, Paul?
Our goal is to try to collect over 6,000 units through the 15th of February. We need to try to make up what we weren't able to collect in January to make sure we can continue to serve all of Connecticut's hospitals. And so, again, we're trying to get the word out and get people to call 1-800-RED-CROSS to make an appointment and then come in and donate.
How far can one donation go?
Well, it can go an awful long way. There are 3 components. One is the red cells, which carry oxygen, the plasma, which basically is the river which takes it to where it's going, and then the platelets. And so when somebody gives a unit of blood, they're actually giving 3 separate components, all of which help 3 separate people. So it's a 3-for-1 kind of donation when someone gives a unit of blood.
Any particular blood type you're looking for, Paul, or any and all are welcome?
Any and all are welcome. Any and all are needed right now. Again, we're trying to get the overall supply up. Of course, we have a critical need for O-negative donor. We're always letting folks know that. But quite frankly, part of our challenge right now is we need every type of blood because we are so far behind. And again, we're trying to really close a gap in a short time because we need to make sure that we can continue to serve our hospitals.
Final question, doctor. A lot of people a little squeamish about giving blood. For a first-time donor, tell them how easy it is.
Well, it's very easy. You really just have to be well. You have to be over 17 years old and show up. It is a little needle stick, very painless.
Can't even feel it.
Basically all you have to do. You sit for half an hour, give the blood, get up and go home.
And the cookies are good.
Yes, they are.
Dr. Lenworth Jacobs, Hartford Hospital. Paul Sullivan, CEO, American Red Cross. Thank you both for taking the time. This is critically important.
Thank you.
Keisha.
Thank you, Jerry. And if you can